Thank you very much, Bob.
This is mute, and then you're going to have to turn it on, okay?
There's a lot I'd like to say in response to what Bob has talked about and comment. We've made an organizational decision to first have the next speaker speak and then start the discussion. I think when you hear the next speaker, you'll see why we've made this decision. It is really a pleasure. One of the great things about organizing a conference is that it's a great opportunity to bring together fantastic people. And when we are thinking about what other voices are very important to have at this conference, the name Olga Runciman kept popping up. I didn't know her beforehand, so I started the research. And I must say, one of the ways that she's described herself, because I was thinking about how to describe her, she's actually done it much better herself, is she sees her profession and her life experience as giving her a possibility to create a bridge between the two worlds of sane and crazy, and to deconstruct the significance and restrictions that are given to these two labels. Olga worked as a psychiatric nurse. Mm-hmm. She knows the system from all sides, inside out, perhaps one could say. She just got a degree in psychology. She is the chair of the Hearing Voices Network in Denmark. She has a very powerful voice, and I'm very excited to hear what she has to say.
Thank you. How do I switch this on?
Oh, yeah. Is there anybody in the room that can help us with the technology here? Or do we need OTAR?
I think we need OTAR.
Yes, please.
Okay. Doesn't switch on by itself.
Yeah,
oh no.
Oh, okay. We need a password.
Okay, so. Well, anyway, I will just sort of start. I have a sort of tiny mini version here. I'm going to be basing my talk on my thesis, actually. So one of the things is I was investigating the effects of, or the subjectivity of taking psychiatric medication. So I actually chose to interview 7 people who were all labeled schizophrenic, who'd all been in the psychiatric system for many years, and who'd, okay, I'll get my slide here going. Right. No. Mm. Oh, there's something. Mm.
There we go.
Okay, and I just click a button here. Oh, okay. Well, actually, as you can see, I changed the name slightly because I actually do think that the Hearing Voices movement is a post-psychiatric challenge to psychiatry. So that was one of the reasons. I think I'll move over here where I don't have to turn around. So, well, I got a very fine introduction, but I'm actually quite proud to be the first officially mad psychologist in Denmark. I think that's quite so. And I'm joining others, also Arnhild Lauving, which is, she's from here, from Norway. So I know both sides of psychiatry, and that has certainly been the most learning experience of everything. I spent 10 years as a chronic schizophrenic, completely given up upon, on the highest pension because there was no residual work possibilities left in me. That's why I had to become a psychologist after that experience. So, yes, I'm a blogger, and also started the network Death in Psychiatry, actually, because there was people do die in psychiatry, and it's for the families and friends. I heard the sad story of one someone who's lost someone yesterday. Anyway, the purpose of my thesis, it was to explore these discrepancies between, the experience of taking medication, those who prescribe it, and actually also to try and give voice to those who are normally absolutely silenced by the system. And I used these qualitative interviews, as I was talking about a bit earlier. So these are people who are all been on pensions, and everything. And there were 3 who are satisfied, were taking medication, 2 who were still taking medication but were no longer happy with it, and 2 who had stopped medication and were no longer part of psychiatry. And this was to try and give a sort of a progressive viewpoint and experience. I found many things, but these were some of the things that the narratives, the stories that these 7 people were told, they do challenge the psychiatric belief system, and especially in relation to medication. I also studied the research literature. I'll come into that in a while, looking at is there any evidence for that there's an interest in the subjectivity of the people who take the drugs, and I can say that there isn't. And that also, what's interesting, I did a counter story or counter history of psychiatric drugs, of medication, and interestingly, psychiatrists viewed the effects of medication when it first came out in the way that people who take medication today view it. That story has completely changed, and again you can read Whitaker's book on that. So, what can a schizophrenic accept? When I say schizophrenic, please remember it's always in this. Very high risk of being a chronic patient. A life expectancy that is on average 22 years shorter in Denmark and 25 years shorter in other countries. In Denmark it's a high youth rate, high mortality rate, and also life as a marginalized citizen. The high youth mortality rate is one of our professors that did a piece of research in Denmark, and she looked that for every 1 person, woman who died in the normal population between 18 and 30, 14.4 were dying in the psychiatric homes and 13.9 in the hospital system. This is extraordinarily high numbers. Now, of course, it's for everything, but one of the conclusions was that suicide was not filling that much. So we're looking at quite serious problems, I would say. So, any wonder? Nobody, the word schizophrenic is feared. I'm very proud to be a voice hearer. I've created my own identity with that, along with a whole community, a worldwide community, and I think we're out there and we're changing the world. So that's kind of more cool than I'm a chronic schizo. Yeah. So yeah, I got Whitaker's book. Yeah, quite sweet, that one. I had a very unhappy egg. Actually, it's really rather sad because my 7 interviewees, of course, showed could fit in well with the statistics. 5 of them had been exposed to sexual trauma. 1 of them had been exposed to, not to sexual trauma, but severe emotional abuse, and 1 of them didn't disclose it, but when he started to talk about it, he dissociated and had to leave the interview. So there is obviously also trauma in his baggage. This is something that we kind of tend to ignore, place very much as secondary within psychiatry. Postpsychiatry, what's that? It's beyond psychiatry. It's a guy, he was a psychiatric survivor, Peter Cambell, who introduced the concept first, or the words, thinking, imagine if there was no psychiatry as we know it today. Wouldn't that be wonderful? This is what I tried to try a little vignette. So, postpsychiatry, the books have been written by Pat Bracken and Phil Thomas, and I'd say that this quote is probably about the closest you can get to an apology. When we name you a schizophrenic, we take away your speech and your ability to name yourself. We obliterate you. The moral position that we must adopt is one in which we bear witness and resistance. To bear witness means accepting the reality of lives harmed and damaged by many things, including psychiatry. We can no longer deny this. Just to say sort of post-psychiatry, that we have critical psychiatry. Post-psychiatry goes one step further in the sense that many people in critical psychiatry still believe that change can happen within the system. Post-psychiatry and Hearing Voices, we do not believe that. We believe that it is not possible to change the system, and we try to work to give voices and alternatives and talk about alternative realities, other ways of seeing the world, and create space for that. And we also work as the Hearing Voices movement. Not only do we have our own helping system, but we're also an activist group. And one of the things is that nobody ever gives up power willingly. It has to be taken back. So, yes. This is Jackie Dalen. The reduction of people's distressing life experiences into diagnoses of schizophrenia means that they are condemned to lives dulled by drugs and blighted by stigma and offered no opportunity to make sense of their experiences. Sadly, that's what a lot of people do. This is the former chair of the Danish Psychiatric Foundation and a colleague. It is open to question whether schizophrenic patients, with their lack of insight into their illness and their cognitive deficiencies, are able to assess their own situation and to evaluate and describe their psychic state and the positive and negative effects of the medication given to them. Unfortunately, this is the paradigm that dominates. So, why do I have ants here? Well, they're an organized society, and they've got structure and everything like that. And, well, what happens when this occurs? We have an ant that's not doing like the other ones. In fact, he's doing the opposite. So what happens with that ant? Huh? There are going to be a lot of complaints about this ant, right? I think I'm going to call him Bob. Yeah. So, Bob the ant, he's going to be complained about. He's going to come under the magnifying glass. And if it happens to be psychiatry, he's going to be exposed to what Foucault called the gaze. And what will they see? They're going to see he's not acting normally. And they're going to say things like, you know, what's he thinking? Why is he doing that when he's not doing this, that, and the other? And they're going to try and imagine what it is he's doing. And then they may even begin to say they know what he's doing. And all this is going to happen without asking Bob the ant, because you can't talk to ants. So, what happens? Discussion amongst themselves. Clear symptoms of schizophrenia, with paranoid tendencies which originate from the genes. A chemical imbalance of the brain, and we have to start drug treatment immediately, and then they'll tell Bob the ant that we've decided that you suffer from schizophrenia. Now, I've got some quotes from the people that I've interviewed here. This is from one of them called Joe, and he says, "When I received the diagnosis of schizophrenia, the psychiatrist said, 'You're a chronic schizophrenic and you'll never ever work again. Go away and enjoy your life.'" I was thinking, well, how the hell do I do this? But it became a little bit of a contradiction, because he would say, if you take these drugs, they'll cure you. Well, if they're going to cure you, why can't I work again? So you're getting all these kinds of mixed messages. This is from someone else here. I was talking with her, she's called Pat, and I said, I was in a conversation, so this is me. So just to get there, did you tell them that you'd been raped? Pat: yes, they knew that I was raped. She was in the closed ward. Yes, they knew that I was raped because it was all to go to trial as well, but it didn't go to trial because, and I asked, so what was it like to be diagnosed as a schizophrenic when you came with such an awful experience as being raped? And Pat says, it's like, what? I didn't even know what schizophrenia meant. Nobody told me. Nobody told me what it meant or what it was. They just said I had this mental disease. So, you've got various little things here. As Bob was in, not Bob the Ant, but Bob Whittaker was also talking, we cannot find physical evidence of this illness. These physical signs, they don't exist in psychiatry. And therefore, there's Bob. He's now become red due to his drugs. So he's got his strange beliefs and things. But I personally don't think it is an appropriate medical practice. And I, of course, have some quotes from some psychiatrists. These are usually taken from forums in our discussions. So this, I think I'll start with this one, the first one. This is trying to defend. Psychiatry is a medical speciality. We have not yet heard of any other medical speciality where the doctor's professionalism is undermined. Who, for example, would suggest that health specialists, other than doctors, should debate the medical treatment of diabetes or high blood pressure? This insistence that it's an illness. Yeah? It is important to point out that the clinical symptoms of people with psychosis are related to complex biological processes in the brain. Most patients who suffer from schizophrenia have disturbances in one of the brain's chemical systems, the so-called dopamine system, and all antipsychotics work by inhibiting this dopamine system. Well, that's quite true, but it's the narrative that's based on it. Here's another selection. One of the things when people, when we debate, you can meet such comments as, here we cannot scratch our heads while we speculate on what is wrong with the patient, because it's completely unethical and irresponsible to let them walk around in that state. This is a sort of a genuine feeling, well, we're trying to help, because psychiatrists aren't evil people. They're also affected by many of the same things that we are. So this is a belief system. This is one story. This is one truth. The trouble is there are many other truths. You can also be met in a derogatory light. We hereby call on little soul searching before such claims breathes life into the anti-psychiatric debate we hoped for was abandoned, or even potentially dangerous. This was one of the psychiatrists who was very angry with me and wrote, your links are controversial and your information harmful for the mentally ill if they were to believe in your references. The references was Bob Whittaker's Anatomy of an Epidemic. Yeah. Fortunately, we're not alone. I mean, we are still, there are more and more professionals, more and more people questioning. We're up against a huge force, but, and I do believe we were discussing that yesterday, it is important to take a stand. So we have Bob the Ant again. What happens when they say no? Actually, people with schizophrenia have the highest non-compliance rates. And the typical explanation is the lax illness insight. And one of the, I'll take another quote. This is one of the people who was compliant with drug taking. It's actually the opposite of this, because this was one of the more difficult interviews for me, because I found very difficult because of the hopelessness he had. He was talking about, I was asking him about the drugs and, what's it like, what's his life like? And I said, so do you write as well? He says, no, I did when I was younger. I wrote things for the newspaper, but not anymore. And when I came here, I really stopped writing and reading. Oh, you stopped reading as well? I say, yeah, because I lost the ability to read, because I can't concentrate on a book anymore. And I ask, is that the side effects or because... And Zach says, it's my illness. I can't drive a car anymore because I get a lot of anxiety and catastrophic thoughts. So I'm way too stressed to do that. I'm afraid to drive. I cannot see a movie because I can't concentrate for more than half an hour and things like that. My life has been, and I say, you attribute this to your illness, or it's my illness, he says. And he says, I have a lot of what we in Danish call sygdomsindsigt, illness insight, I say. Insight, yeah. So I've been told, and so I participate in a lot of research. So, yeah. So there's different ways. This is people who have accept medication, and he was constantly suicidal. Forced treatment in Denmark, we talk about trying to lower it. The latest results that have just come out show that it is highest ever in some areas, and I think it's important again to look at the Juan Mendez. Actually, there's come an even stronger statement, but it says to ban all forced and non-consensual medication. This is something all nations we're supposed to follow, but we don't. Again, it's too long to go into a discussion, but it's very sad. So anyway, if we get back to non-compliance, can there be other explanations, and that lack of illness? Or illness insight. I think we need to look at academic psychiatry as it is today, and it is profoundly reductionistic. It emphasizes the importance of experts. It emphasizes the technological framing of an illness paradigm, of things can be found in the biology, and it's a removal of the context. That I think so really very, very sad here. And I'd also say that psychiatry is a modern enterprise, and it's actually based on the Age of Enlightenment. Now, I'm not going to explain all that one because that would take such a long time. So I've decided to explain it with the use of an avocado and an onion. And psychiatry is the avocado, and postpsychiatry and the hearing voices were the onion. So anyway. You're supposed to imagine that this avocado is a whole person, right? And you're looking at it through psychiatry's eyes. And if this was Bob the ant, who's now become an avocado, but he is a voice hearer after all, so he's allowed to have different realities. What would happen then is that psychiatry takes out the pep and is trying to understand, reduce, and trying to find the truth, the universal truth. Where is this schizophrenia? Where can I find this schizophrenia? And all the things that have context, meaning, life, the life story, understanding, the human being, which is what's surrounding this pep, if you like, is removed. So we, of course, believe that we can't exist. There is no human psyche at all, or psychology, without context. It's not possible. In other words, there is no core, there is no universal truth, there is multiple truths, there's multiple realities, there's a multiplicity of ways of looking at the world. So, yes, there can be an explanation for another form of and if we only started to listen, then we might have another explanation for why there is non-compliance. I, of course, have some quotes from some of my people here. I'll start with this one. This is Joe, his opinion on what might help. And he says, I honestly believe that everyone who prescribes it should take it. And it's not just the taking that's important, it's the social environment that goes with it as well. And I asked, describe that. And he says, what they should do is they should make you take it for a minimum of 2 months, but put you on a terrible housing estate where you're victimized for how you walk and how you can't sort of get eye contact. You're shuffling around, and then they'll see, actually, this isn't schizophrenia. This is a consequence of what you put in my body, and I think that's what they need. Then they would live the experience and get some more understanding of how devastating it is for people to take the drugs. This is Pat. She's still on drugs, but is on her way out off the drugs. And she was describing a situation. She says, I'm just on Risperdal now, but they've given me breast milk, and the sulpiride stopped my period, and I said to my psychiatrist, "Can you take me off sulpiride?" Mac overheard me having a conversation with a friend about my period, and he said, "Pat, I'm not meaning to butt in, but I think your sulpiride is the same as Risperdal," he said. "Stop taking them if you can, because that's stopping your period." So when I went to the psychiatrist, he said to me, "Well, what would you rather be, well in the head or have a period?" I said, "Well, I like to have both." And I said, "Well, you being a man, I can't really talk to about periods with you." So I said, "How would you like it if you, for example, couldn't get it up?" And he went, "Ooh, why are you being so personal? There's no need." "There's no need to be personal, Pat." And I said, "I'm not being personal. I'm just trying to tell you that, you know, if you couldn't perform, you wouldn't be happy if you knew it was the drugs." And he said to me, "Oh, well, we all have to make sacrifices." And I thought, no. So, yeah, she's fabulous. So what we're proposing along with postpsychiatry is, of course, that there's the multiplicity, different perspectives, meaning is primary, context, the importance of other explanations. I mean, there's a myriad, there's just as many explanations for madness, if you like, as there are people. So, anyway, why are voices silenced? I think this is also a very interesting question. And certainly why our voices are silenced, because you can say that people with the schizophrenia were probably psychiatry's raison d'etre. We're the most mad. We are the reason of why psychiatry really can define, exist and define itself. So if we come in with our stories and introduce context and meaning and make madness meaningful also for others, then it starts to get very difficult to talk about force, about psychiatric, I'd call it abuse in many ways, the treatment. It really is a big threat. And that's why one of our things is, one of the most powerful things that we do is travel the world. People, we are found in every country almost. We travel the world and tell our stories. We create meaning, not just for ourselves, but for everyone else. And this is probably one of the biggest dangers that psychiatry, because once it becomes meaningful, it becomes really difficult to mistreat people. Anyway, oh yes, here. So what do you think when you see this tree? It reminds me of Bob's tree, actually. For me, I don't know if any of you have seen that film, Avatar. Oh, I loved that movie. I thought it was a great movie. Where they're on this planet, and the Tree of Souls was all their ancestors, their family, and that was to be defended with everything that they had, right? Well, for me, this is psychiatry's mother tree, right? Together with the pharmaceutical industry and themselves, they're going to protect it. And it's so important, and why? I consider it's their pill tree. And this pill tree has invaded our society on every level. You find it in the homes, in our language, in schools, everywhere. And this is kind of, their ancestors, I suppose, in a way. So, and what is holding this tree together? Well, it's the glue that keeps this whole tree thing together. It's because of the pills. If we chop down this tree, we would have a true post-psychiatric era. Now, I don't know if that would be better. Sometimes things, when changes, you can make it worse, but I'm beginning to think you can't get much worse. This is part of my research. I was inspired by John Reed and Jim Geeky. They looked at the subjectivity of getting the label schizophrenia. They looked at two databases. I looked at 5 databases, and I was looking for the subjectivity of taking medication. Is that to be found in the research literature? And out of thousands and thousands of articles, I found only 14. And I might have missed a couple, I'm probably, but I think we can conclude that the subjectivity of taking psychiatric drugs is of no interest in the psychiatric literature. And again, one of the reasons is that if we began to listen to the people, we'd have it would start to become more difficult. Fortunately, we have the internet on our side. What could be said that is so dangerous? Well, that is that the medication doesn't work, and that the way that psychiatry views medication as helpful is not helpful, and it's certainly not the viewpoint of most patients. And I'm talking. It's very interesting. I mean, I'm going to put my thesis on the Mad in America blog, so you can read it. But what's interesting, I think, is more the follow from people who've accepted medication, how you incorporate that into your narrative, and the illness story, and this. And then when they're on their way out, the beginning, the two people who are still taking drugs and were still in psychiatry, but they were beginning to think, they were beginning to find other explanations. Both of them had found the Hearing Voices movement and were beginning to see that, well, there's another explanation. My voices, my paranoia is meaningful, and begin to move out from there. And I just want to try and have one voice, or if you like, one story, if you like. Yeah. So, yeah, it's quite cute, isn't it? Yeah. It's one of the people who's still on drugs. She made a very profound impression on me, because she actually didn't talk that much about her drugs, but more about her life, and that was Pat, who came in originally because she was raped. She'd never heard of schizophrenia or anything, so she came into the hospital. She tried to commit suicide, so that's why she was in the closed ward. And she was, they could see that she was talking to herself, so they asked if she heard voices, and she said yes. And the whole thing changed for her. It was actually due to go to court that she had been raped, and so on and so forth, but the focus became on that she was ill, and she suffered from an illness called schizophrenia, which she had no idea what was, because nobody was explaining it to her. And they said that she needed to have this treatment, which was drugs, and they started to force medicate her. What happened was that she began to get worse and worse, and from the psychiatric viewpoint, they were saying, oh, her schizophrenia has really burst forth, because she started to say that the staff were trying to poison her. She started to not want to eat or drink in the hospital, and she began to lick windows, condensation of windows, and began to drink from puddles. Now, as you can imagine, if you're looking at it through the lens of psychiatry, you are looking at someone with a severe schizophrenia, which is getting worse and worse, and the drugs increase, and so on and so forth. And you have this one dominant story. Now, Pat, of course, as she's called, has, well, that's not her real name, but has another story. Only no one listens to that story. And this story is unfolding at the same time as the psychiatric dominant story. So, in her case, she ended up being what we call the revolving door patient. In and out, chronic, this, that, and the other. And then she discovered the Hearing Voices and is on the way out. It was her who had that conversation with the psychiatrist. And when she gets to tell her story, she has one of the most horrific stories I've heard in a very long time. She was herself born of a rape. I have asked these people, and I use their names anonymously, but it's okay that I refer to their stories. She was a product of a rape herself, and her mother hated her passionately. So from a very early age, they lived in a poor part of town, so they had this cellar, coal cellar, where you could put the coals in there. So from a very early age, she was put in there as a punishment. She never knew when she could come out. It was dark, and she began to hear her first voices in there. She was put in there sometimes for 2 days. When her mother discovered that she tried to smuggle food in under her clothes, her mother started to send her in naked, so she tried to hide food inside various parts of herself. She tried to hide the food under the coal. She was a child, and the moon would shine on it, and she would think that the food was there. But when the moon moved, it had, of course, moved the food there. So she would spend her time there. How did she survive? One of the things without water, she licked the windows, the condensation of the windows. So already there is another story unfolding there. When she was about 7, they moved. And they moved into a house where there was no coal cellar. So the mother found other ways of torturing her daughter. And one of the things she would do is that she had to have bath nights, at least 3 times a week, and the mother would try to drown her. And so when she became, completely relaxed, she was allowed up. They also got a toilet for the first time, I think. So her mother would also use it and stick her daughter's head in there. She was extremely abused as a child, and her mother would always be telling her, "I'm doing this to help you. I'm doing this, because she was carrying her own distress from her life. Not that that is an excuse." When she was 13, her mother died, and she was moved into a foster. Not a foster home, but an orphanage kind of place. And from then on, she was exposed to sexual abuse, and she had to do things with other kids. She refers to the man as an alien. Even today, she cannot say his name. So what is happening? You have a story, a life story there, and a ways of surviving. She has had to learn to survive. Right, so she's tried her best, and now she's suddenly been assaulted herself, raped herself, and tries to commit suicide and is now put in this hospital. And what's the hospital saying? We're doing this for your own good. We're doing this to help you. I think what's really important about these stories, this is just tiny little vignettes of the stories, is that there is other realities, there are other narratives, and many, many times, because they don't disappear, just because you become a patient, if you like, or part of the psychiatric system, and your story is never heard anymore because you are silenced. And you become into this, well, I certainly for myself experienced it as a Kafkan kind of world. Every time I disagreed, I'm afraid, Olga, you're psychotic, you need some extra medication. Do you want it? No, thank you, I think you should consider. This sort of thing. Or if I did agree, oh, you're getting better. This extraordinary sort of subjectivity that occurs of a very powerful system that can do pretty much what it likes. I think that these stories exist nevertheless, and very often they become intermingled with the dominant story. You don't see them, but they feed into the dominant story and very often justify the dominant story. And if we're not prepared to take these questions up and look at it, then we have what I would call this psychiatric abuse that we see constantly unfolding, and especially for people with voices, especially for those who are labelled schizophrenics. So, I don't know if I had any more quotes I was going to say. No, yes, wait a minute. Did I have the blue ones? I think I did the blue ones. Let me just see. Yes, I had all my quotes there. So, what I'm trying to say, at least what I try to say, I mean, so even in this I don't do justice to the 7 interviewees, but I think that they do introduce that there is a huge gap in the production of knowledge. And I think also we cannot continue to ignore the voices, and therefore, you know, the rights of people who are in psychiatry. And that is why I personally do believe that we do need to take a stand. And as I said earlier, people in power do not give up power. And that's why I think that the Hearing Voices and the postpsychiatric thought belief system, belief, that sounds almost like a religion. I'm being just like perhaps an us and a them, and in a way I probably am. But is that we do need to take this stand. And I'm very happy to be here today. 24 nations. That is an amazing thing. So I'll say thank you very much, and I'll say it in Danish. Tusind tak, for that's my where I live. Oh, det var dejligt, I kom. And Spanish, I can't do 24 languages, but Spanish. Muchísimos gracias. Fue un placer. Gracias.